Welcome back, everybody. We are starting off the year with health, no doubt about it, right here on Better Western Mass.
Cardiologist Dr. Amir Lotfi is here with more on heart health. And Baystate, this weekend, in fact, are kicking off a lecture series. Tell us all about that.
Yes, as everybody knows, February is Heart Month. And so Baystate, during those 4 weeks, will have lectures. We will be starting talking about the two lectures we're going to talk about starting on Sunday is something called chronic total occlusions. That's when people have one of their arteries completely blocked, 100%, and they have their own bypasses developed. And we talk about when and if you need that intervened on with stents.
So it is something you can get ahead of then.
Yes.
Wow.
And so, yeah, exactly. And so there's some people we treat with medications, and the people who are on medications but continue to have symptoms, now we can offer them a procedure to see if we can improve their quality of life.
What are some of the symptoms?
Chest pain, chest tightness, shortness of breath with exertion. And so usually what we discuss is that this is more than just putting a stent because it's more complicated, trying to grow through 100% blockage with a wire that's 14,000ths of an inch. So, you know, we discuss the risk and benefits, those kind of things. So we're going to discuss indications, who would benefit. And then the second topic is people who have atrial fibrillation, who have an increased risk of stroke but can't take blood thinning medication. Now we offer a device that goes into a little room in the left side of the heart and closes it off where 90% of the blood clots are formed.
Wow.
And it's called the Watchman device.
Oh, that's really impressive. And I guess overall then, is there something that maybe somebody would know? We were talking about some of these signs. Like, let's say I had that chest pain.
Right.
Is there something I should do instantly before I call or after I call 911 and I'm waiting on possibly authorities?
So, no, I think your point is great because the nerves in your chest all are interconnected.
Yeah.
So sometimes when you feel like you're having heartburn, you're having a heart attack.
Really?
Yes. And sometimes when you feel like you're having a heart attack, it could be heartburn. Right now, and when it comes to heart muscle, time is of essence. So if you're having chest discomfort or something that's unusual for you, call 911.
Right.
Instantly.
Yes, and get evaluated because it's better to be safe than sorry.
Who's at risk here?
At risk. Great point. Going to heart healthy. I'm going to reverse that question for a second. People who really want to reduce their chances of heart attack or stroke, 5 cornerstones: blood pressure, weight, exercise, not smoking, and limiting alcohol. If you have that, what's been shown, you can, by the age of 50, you can reduce your chances of heart attack or stroke by 80%.
Wow.
So if you have these risk factors, work on them. But those are the people that you think about that you should be aware of.
Great info.
Yeah, Dr. Lotfi with Baystate Health here, happening this weekend, this Heart Healthy series. You're going to want to check it out. You can't live without a heart, folks. You really can't. Don't mess around with this thing. All right, coming up.